All righty. Thank you all so much for joining. We're sorry we're getting started just a couple of minutes late, but we're also probably going to have some people joining in as the hour goes on. And we also are going to have some people who are joining us on the replay. So hello to those who are joining us on the replay. We're excited to have everyone. My name is Dr. Dionne Middlebrooks. I am a physical therapist. I'm also a doula, and I have the pleasure of having Mrs. Tyradisha Anderson with us tonight, and she is also a birth doula, and we're just going to be going over some of the benefits and the impact of having a doula a part of the pregnancy and birth and delivery process. So we're going to go ahead and jump into things, and I'm going to go ahead and share my screen. All righty. So, like I said, we're going to be discussing the impact of doula care when it comes to the birth and delivery process. And I just want to give a chance for both myself and Tyradisha to introduce ourselves. And first, I will let everyone know that Tyradisha, she is affectionately known as Ty. So throughout the process, I will be calling her Ty doing this. So if you have any questions for her, please feel free to call her Ty as well. And I'm going to have her introduce herself. So Ty, please go ahead and share a little bit about you.
Well, hello, everyone. My name is Ty Anderson. I kind of fell into this work. Back in college, I just was a natural nurturer and was supporting people and didn't really have a name for it. Honestly, I was just being a great friend and walking with people who were giving birth. And as I matured, and definitely during the pandemic, we put a name on what I'd been doing, and the passion to love and support our mamas came to fruition. And that's when I went into becoming a doula. So outside of that, I'm a mama of 2 boys. If you happen to hear them, that is why. And I love, and I have a husband, and we reside in South Carolina. And so I just love doing the work and supporting others.
Perfect. Awesome. Well, thank you so much for joining us tonight. And I'm super excited as we are jumping into everything. All right. Give me just 1 second. Having some problem. There we go. All right, and myself, as I mentioned before, I'm Dr. Dionne Middlebrooks. I'm a physical therapist and a doula. There's some information about me, but the most important thing on here that you can know about me is that I am happily married, and we have 3 children. We have 2 girls and a boy. So supporting maternal care is definitely something that is close to my heart, and actually something initially when I was going to physical therapy, I was not interested in. But things change, and I am so happy that I've developed a passion to be able to serve these mamas. So now we're going to jump in, and before we actually discuss the impact of doula care, we really want to take some time to provide some education about different stats that are present here within the United States when it comes to maternal and infant health. So we're going to jump into that next. And just to let everyone know, that for the U.S. Maternal mortality rate, women of color are 2 to 3 times more likely compared to Caucasian women to actually suffer pregnancy-related death. Pregnancy-related death itself with this maternal mortality rate does include up to 6 weeks postpartum as well. In addition to this, when the U.S. is compared to other countries, we have an incidence that is 10 times higher with those that have similar income and economic status as us. Unfortunately, this trend has continued to worsen over time. So Ty, please give me your thoughts about this U.S. maternal mortality rate.
Well, we do also know that just for the Black and Brown community, there is this unconscious bias that we have this high tolerance of pain, and that when we're saying we have needs, they are not being met. And so I remembered learning about it, but of course, thanks to Mr. Google, I was able to look it up. And it even goes back to who we consider, or who the US considers to be the father of gynecology, Dr. Sims. He was performing surgeries on Black slaves unmedicated without any anesthesia because he felt like it was unneeded. And so this is someone that people are raving over, and he started this. Okay, so we're not being treated fairly, which means when we say something is wrong, we're being ignored, which is leading to this mortality rate. And this does not just mean if you're of a certain social economic status. This is affecting low income as well as highly educated Black and brown mamas. So it's very important that we are there to advocate for each other and ourselves.
Yes, and there's one additional thing I wanted to add on. CNN at the end of April actually released an article based upon a recent study from Boulder, Colorado, that indicated that when it comes to maternal health itself, Black women have a higher incidence of having to undergo induction and C-sections and different procedures that may or may not be necessary. And this also can be related to the maternal mortality rate, because unfortunately, there are a lot of times, as Ty already said, where our concerns are ignored. There have been studies that have been completed with healthcare providers where healthcare providers have said, we didn't realize Black women experience pain the exact same way as other races, which is so unfortunate that we have these healthcare disparities that exist in our country. We've come a long way, but we still have even further to go to make sure that we ensure the safety of all women, especially our Black and brown women. All right, so now we're just going to discuss the C-section rate. So within the US itself, 1/3 of births result in a C-section. This continues to increase over time, just as the maternal mortality rate. And according to the World Health Organization, that is what the WHO stands for, our C-section rate is much higher than what is recommended. They typically recommend that countries be within the 5 to 50% range, which is ideal, and reserving the C-sections itself for individuals who have a medical need. Unfortunately, minorities, we are more likely to undergo C-sections. And with this being said, as I just mentioned, a lot of them may not be due to medical necessity. I would love to hear your thoughts on this.
Well, one of the things I was sharing with Dr. Middlebrooks is that when I was studying to become a midwife, we had to look at our hospitals' C-section rates in the area should a mother be referred to different hospitals. And what I found very interesting is that the hospital that predominantly catered to individuals who were getting state-assisted insurance had a much higher C-section rate as the hospitals that were in certain affluent neighborhoods. Mm-hmm. And so my thought goes to, is this about the dollar that it will generate towards us or towards that particular company or that hospital, or is it about medical need? I've worked with clients where the doctors came in because they had been laboring for a while. I'm like, we need to move to a C-section instantly. That was their first go-to. The baby was not in distress. Mama was not in distress, but they felt like since they had been laboring for an extended period of time, that it was time to move. And so it's really, again, going to what we'll talk about later, the ability to advocate for yourself, knowing that you know your body best and when and where to say, hey, I want to wait because I don't think it's necessary at this point. But a lot of times, we assume that the doctors have all knowledge and that they're operating in our best interest. So whatever they say is what we have to do. And so that's about educating yourself and to just reduce this, because once you have one, they automatically say you got to have the next one has to be a C-section. And that is not true.
Yes. And that in itself, we brought up one point that I really want to kind of just hone in on, and that was the point as far as, are they doing this for a potential financial gain? Because it is something that we do have to consider here in the United States. Our healthcare system is a business. So when you do build certain codes, when you do build certain procedures, it does cost more money, which means at that point, you're able to bill insurance at a higher rate. And even though insurance may not pay everything, now they still have to pay you a larger sum or larger fee than what they would have to in any other situation. So just something to be mindful of is that are C-sections occurring because they're absolutely necessary, or they're occurring either as a convenience to the doctors, where the doctors are like, no, I'm going on vacation, because I actually have seen that as well, especially around holidays. They start planning when people are going to be induced, or start planning, we're going to schedule this C-section. Is it something that is a true medical need? Is the mom or baby's life in danger or at risk? If so, then yes, a C-section may be the best option. But if those are not the cases, then I truly do advise that you advocate and you ask those questions as to why are we moving towards this, and is this truly necessary? All right, and then the last statistic that we're going to bring up so that way we can kind of move into the impact of doula care is the infant mortality rate here in the United States. So in 2020, the US had the highest infant mortality rate compared to countries of similar economic status. And once again, minorities are at a higher risk for our infants actually dying during birth. Now during either pregnancy itself or even 6 weeks after. Now, I do want to be mindful that one reason why the US has a higher mortality rate, just to be transparent with everyone, is that we do have a larger window when measuring infant mortality. However, with our country being as developed as what it is, the statistics with this are shocking, because our women and our babies should have much better care and attention than what they're getting. And minorities are at higher risk of having babies that are preterm and also higher risk of having babies that are low birth rate. And that itself can contribute to the infant's health being at risk. And Ty, I would love to once again hear your thoughts about this topic.
So prior to living in South Carolina, I lived in Memphis. Memphis made one of those Dateline reports about their infant mortality rate. And it coincided with teen pregnancy in specific zip codes. And what they found was that, one, they were not getting adequate prenatal care, but they also did not know how to support their babies, and they were not using safe sleep. And so because they weren't, they were trying to figure out how to put some things into place. So one of the things they did was at any health department, you could go in and say, I don't have a place safe for my baby to sleep. And they would provide them with a pack and play, which a child can comfortably sleep in until the age of 1. And so that was one of the things they put into place. But again, this was after they made the news. This was after they saw the numbers continually increase, and those numbers still haven't gone down, because I know that because I watch the news and I am being educated and I know how to advocate for myself. But I have been in the health department, and there's no signs that says we're offering pack and plays if you don't have one. So we're offering you WIC, but we don't talk about where's your baby sleeping and what does safe sleep look like. Oftentimes, they'll say, well, you need a sleep sack. No, you can swaddle a baby to prevent that. But we know babies are supposed to sleep on their back on a flat surface with nothing else in it. But I know that because of the education I've received, but not everybody else. So that plays into it. And also unhealthy mamas who are trying to feed babies who are not well themselves, and they want to solely use breast milk, which is an amazing thing. But we need to make sure mom is healthy so that this can be a successful tool as well.
And I know Ty brought up the infant sleep habits itself. So just to make sure everyone is aware, when it comes to safe sleep, infants, as she mentioned, are supposed to lay on their back. They're also supposed to lay on a flat surface, as she also mentioned. You want the surface to be a firm surface. And it is advised within the US that you not share the same surface as your infant as you're sleeping. So yes, there are some co-sleeping devices that do allow for you to practice safe sleep. There are also some co-sleeping devices that do not allow it. So it is important that people are made aware as to what is considered safe and what is considered unsafe. And then of course, we would hope that mom, as she's taking care of the baby, that she's not smoking or she's not on any type of impairment drugs itself, because that also can impair her ability to be able to care for the infant. And just a few other tidbits as well. They do believe that infants who are using a pacifier have a decreased risk for SIDS as well. And then infants who are breastfeeding are also decreased risk for SIDS. So just providing this basic education, simple facts that people don't know, can be something that we can do to try to help improve this, especially with the fact, as Tarnisha mentioned, that they don't have it posted saying, hey, we can give you a sleep set, we can give you a playpen or a pack and play. That way your baby can have somewhere to sleep. So it is our responsibility to make sure people are educated. So now we're gonna jump in to what is a doula. And I love how Tarnisha explains what a doula is, and I also love her personal experience. So I'm going to ask her to share with us what a doula is.
A doula is one there to support you, and not just the mama, but the mama's partner, because the reality is they're in it together. And so you want to support them. It's someone to advocate for you, someone to help you understand what is actually going on with your body. Oftentimes when we go to the doctor, they're very quick visits, right? 15 minutes to 30 minutes, you're asking your questions. But there's questions that come from those questions, or there's questions that come in the middle of the night. And that's someone that is there for you to support you. We are not medical professionals. We are to give you the information and you to advocate for yourself, but it's to empower and educate you so that you can be the best mommy and best parents that you can be before labor, during labor, and after.
Perfect. And I wanted to emphasize the part that she mentioned, that a doula is not a medical provider, because you will have some medical providers such as myself who do step into the role of a doula. However, when I'm in the role of a doula, it will be out of line for me to step up and try to communicate on the patient's behalf. I'm supposed to communicate with the client, because at that point, that is what the pregnant woman is. She is my client. She is not my patient, even if I've treated her for something else. So my goal is to step up for her, to be there to support her, to teach her how to advocate, to be there so that way she can express her needs. So it is important, because I do know we do have some medical providers that are on this call, and I want to make sure that we're aware that at that particular time, we are not functioning. For myself, I'm not functioning as a licensed physical therapist. I am functioning as a doula support personnel, a support person. So it is important that we differentiate the two when we are there for these moms. So now, a type of birth that a doula can be a part of. We can be a part of a home birth. We can be there for the hospital birth. I do advise that you speak with the hospital about their policies, because as Ty and I were discussing earlier, there's certain hospitals now that aren't allowing us to come in. We can be there at a birth center, and also doulas can be present for both vaginal and C-sections. But once again, it does depend on the hospital policy as far as whether or not you're able to be present for a C-section. In the case of an emergency C-section, more than likely it will only be the doctor that's needing to perform the surgery and support personnel for that for the physician. There are times with the emergency sections, they will allow for the partner in, but a lot of times, just to make sure everything can go as quickly and smoothly as possible, they'll kind of take mom out. And at that point, the doula will communicate with the partner. But Ty, are there some additional places that doulas can be a part of a birth, or how at least can you expand upon how a doula can support in these different environments and how that support may look different?
Well, of course, at home, there's different things a doula can do at a home birth. A doula at a home birth could be wrangling the other children. When I say wrangling, they're entertaining, they're keeping it so mom can have a safe space and have the ability to just concentrate on delivery. In a hospital, she's helping set the atmosphere. If she wants the lights off, if she wants aromatherapy, if she wants techniques to really prepare herself, all of those things. So doula, it looks different. It's about what that mama needs. I was meeting with a client earlier today. I was like, what do you need from me? And hers was, I just need help to do a birth plan. Okay, well, then we started talking through that. So it's really, what does that mama needs in any of those settings? And what I was telling her is, a plan is a plan until we have to plan a different way. Nothing's in concrete. We start off with a plan, but if we have to pivot, we're going to do what's necessary to keep you safe and baby safe. And so in all those situations, that's the ultimate goal, to answer questions. I actually was, before we could get in the hospital again, was texting with a mama who was at the hospital. She was in labor and she's like, Ty, they just said this. What am I supposed to say? And so I gave her some questions. And then she came back with a text. I was like, you're laboring. Where is your partner? Let me talk to them. And so then passed the phone. And so we were having conversation that way, just so that she could get all her questions answered and make an educated decision. That's the ultimate goal. You want to empower so that they can make educated decisions for themselves and their family.
Perfect. Awesome. All right, so now we're just going to talk about what is the cost of having a doula. There is a price that it does depend upon your area. So within Atlanta itself, the average price is usually between $1,000 to $2,000. Sometimes it's a little bit more. Sometimes it can be a little less. I know in the Georgia area, we did have a pilot program that was initiated so that way we could kind of test the waters to see with Medicaid coverage, because some states are allowing for Medicaid to pay for doula services, which is fabulous. And then there are some private insurances that may reimburse you. It does depend upon your insurance. And a lot of times this does ask for additional documentation. So Ty, do you know of any other I guess programs or incentives that exist to try to assist with doula coverage?
So I do know in some states that have higher infant mortality rates, there's grants out there where there are doulas who are trained to service those communities with those higher rates. Memphis has one of those amazing programs where the doula services are free of charge to individuals who qualify in those specific zip codes, and they're amazing doulas. They're from their communities. They're there to support. So kudos to those kind of programs. I've heard some talk about South Carolina getting birthing assistance and doula programs for community birth workers is what they're calling them. So there are programs out there. So if you're interested in doing the work, it's about digging out and finding where can you do that to serve individuals who might not have it. It just really depends on what demographic you're looking to serve. I do know, I read an article that TRICARE was moving to covering doula services because they had done their research about mamas whose husbands were deployed and the stress that was causing on them. And so I was really excited about that. And it did require specific doula training certifications in order to receive that. So you have to be mindful that if you're interested in billing, to make sure you're following all of the requirements in order to get billed, if that is how to do billing through insurance.
Perfect, awesome. And the TRICARE one made me a little excited. So I'm a little off topic, but as a wife of a military veteran, that itself makes me excited because a lot of women are having babies by themselves, especially when it comes to the military. And I know Ty also, she is the child of a military veteran. So that one itself hit pretty close to home. So thank you for sharing. I did not know that. That's one I actually have to look into now. All right, so the benefits of a doula. We're going to go through each of these, and I'm going to ask Ty to kind of expand upon this a little bit. But before we do, I just want to emphasize, because there's one part that we did not mention. There are different types of doula. I myself, I am a birth doula, so I'm with you to help prepare you for birth and delivery, and I'm also with you after the delivery. And I do offer a visit, one visit postpartum. The reason why I bring that up is because there's a such thing called postpartum doulas. And in all honesty, I think every mama could use a postpartum doula. And I'm going to have Ty explain a little bit about how a postpartum doula can be impactful upon a new mom's life. And then we do know that at times with birth and delivery, that tragedy can strike. This is something that we do not want to happen. However, if it does, there are some wonderful doulas out there that can be there by the mom's side, either as death doulas or stillborn doulas, to help serve the mom and provide the care that she needs, because she still will be going through a postpartum phase and period. In addition to that, she also is going to be going through mourning as well. So there are different types of doulas. So just something to keep in mind if you're looking for doula care or if you know someone who is in need of doula care. So first, we're going to jump into the evidence-based education. We've already hit on this a little bit because we've already emphasized the importance of a doula being able to help educate. As mentioned, a doula is not serving in the role of a medical provider. However, a doula is serving in the role as support as far as education and providing information. So when a doula is present, they're able to help tell you, okay, so this is what research and this is what clinical studies have shown us. This is what we've noticed with women who've undergone this procedure. So that way the mom can make the best decision for her. And it is not our goal to try to cast our own desires or beliefs upon the mom. Our goal is to educate the mom so that way the mom can do what she feels is best. And Ty, I would love to hear your input on this.
Sure, I'm going to back up just a smidge to talk about the two types of doulas. Even before you get pregnant, there are doulas who do fertility. So walk with mom, because that is not always a safe place, safe topic in some cultures. And so there are doulas who specifically walk with moms to get them pregnant and then move into the other areas. And of course, postpartum. Postpartum is just a magical time because we call it the fourth trimester, right? You brought this cute baby home. Everybody's rushing to hold the baby and nobody's talking to you. I just watched a Cosby Show episode. Sandra had just had the twins. She walks in the door, everybody grabs the babies and nobody talks to Sandra. She even says, hey, how am I? Great, but nobody cares, right? That was a sign. A lot of mamas are feeling like that. So in postpartum care as a doula, you're really taking care of mama. And that's going over there if she needs, again, the other kids to be entertained so that she can take a hot shower. That's what you're doing. If she needs some meal prep, you're offering meal prep. If she needs someone to teach her how to change a diaper or how to care for where the umbilical cord, those are the things you're working through. New, not so new, but in the last couple of years, they've got postpartum doulas who come and do night care.
Yes.
So mama can sleep. And that is so amazing. Like mama pumps, she goes to bed and she gets a good 12 hours of sleep. Okay.
Yes.
And while that doula is there, they handle laundry, they clean the bottles from the day, they restock, baby, whatever that baby might need, they're taking care of that baby. And of course, if that mama chooses to breastfeed through the night, they would knock on the door, give baby to mama, mama feed, and then give baby back. And then they take care of all those needs. So postpartum is amazing. That is a totally different package for some doulas. And sometimes they're full spectrums and they want to do it all. Mm-hmm. More power to them. Okay. Because I like to sleep too, so I'm not called for that part. But with educating, I think it's so key to educate mamas. No question is a dumb question when you're a new mama. Mm-hmm. No question is a dumb question if you've had a baby before and there's a time gap between them, right? There are things that you just want to know. You want to be able to ask your hospital. Some things is you want to know what you should ask so that you are getting the best answer. Because if you go in with a vague question, they're going to give you a vague answer. But if you go in with, I need you to answer this, you're prepared, and the doctor will spend more than that 15 minutes with you because they're going to make sure all those questions are answered. And so that's key. And of course, creating your best birth experience. There's so many mamas who don't have another baby because they've had a traumatic birth experience. And that's all they have etched in their memory. When they went unheard, they went unseen, and they almost lost their life. And it could be totally different if they have the assistance of a doula to help them get that education.
Perfect. I actually think you summed up probably a good portion of these benefits, which is fabulous because she already went into the emotional component. But a lot of people don't realize that postpartum depression, it hits hard. And a lot of women don't understand that it's nothing that they've done. They don't understand that some of it is actually due to the hormonal changes. And they also don't understand that having a baby can be overwhelming. As Tarnisha said, you have this cute little person, and then everyone wants to pay attention to the little person, and no one wants to pay attention to you, and you're trying to give everything that you can to take care of that person. So in addition to the doula being there for that support to try to help you with those different tasks, that also provides that emotional relief. And also that doula can help communicate with you and let you know, hey, you have some different warning signs, some things that are concerning. Have you talked to your provider? Okay, let's go ahead and get your provider on the phone so that way we can make sure that you are taken care of. Because in order for you to have a healthy baby, you want a healthy mom taking care of that baby. And so you're there to make sure that she's getting what she needs, both physically and mentally. And clinical aspects, me being a physical therapist who specializes in pelvic health, I see a lot of women who have pelvic health issues, and some of these issues are related to different things that occur during birth and delivery. So doulas actually, when doulas are involved with birth and delivery, it is shown that they have, their clients have a reduced use of vacuum and or forceps for actual delivery itself. That can be a traumatic experience just because of the knowing that an outside tool is being used to assist, but it also can potentially cause trauma. And even without those, birth itself can still be a traumatic experience simply because you have a whole human being coming out of your body. So that is a lot to deal with. When doulas are involved, the babies tend to have better APGAR scales. This is a measure as to how healthy the baby is shortly after birth, where they're looking at different things such as the baby's tone, the skin color, looking at how the baby's breathing, those different things. When doulas are involved, the moms have a less use of Pitocin. Pitocin is pretty much a chemical form of oxytocin, which the body needs to try to cause those contractions. So Pitocin is used when they have to induce labor. So if doulas are involved, this pretty much means that now they're not having to induce labor as much. So because of that, now we don't have a high risk of C-section because a lot of inductions do end up in C-section, unfortunately. And overall, doulas, when they're present, the mom has a better birth satisfaction, or she's more pleased with how the experience went. And earlier, Ty mentioned that if you, right now we're going to focus on plan A until we have to get a new plan. Even in the times where a new plan has to be developed, it has been shown that because doulas are involved to help be there for that support, that the moms are still pleased with the entire process. And then this one I actually can speak on, not for myself, but actually yesterday with a friend. She had a traumatic experience, or her husband was really taken aback. So he's still kind of dealing with everything, but with her, she was the one who was rushed in for an emergency C-section after things took a turn in which the baby's vitals started to drop. And she'll tell you, her doula was there the entire time. Her doula helped her to make the best decision. And because of that, she felt confident in telling the doctors, yes, I agree with what you're saying. I see what you're saying. I understand the risk. Let's go ahead and proceed with the C-section this way. So she was fully educated. She fully understood, and she made the decision. Because she made the decision, she said, I felt like I still had a great birthing experience. She says, regardless of everything else, regardless of things did not go the way I planned, my experience was still mine. And that in itself is just, that's wonderful. That's what we want women to have. We want them to be able to own that experience regardless of what happens. And I see Ty, I'm gonna let you kind of speak on that a little bit because I saw your eyes perk up a bit.
Absolutely. Even if your experience has to change, when you've been educated on your decisions and you have been able to give that gentle pushback until you feel like this is the answer, then you realize that you've had a say. Now, I said to that client, that plan A is our plan A. If your heart rate changes, that baby's heart rate changes, something goes awry, we're going to go with what an emergency situation does. We go with the best option is. But if it's just because you're laboring a long time, it doesn't seem that the baby's ready because you got to the hospital super early, then we're going to wait it out. And we're going to find comfort measures, whether that's through medication, if that is the route that you choose, or if it's between us showing you how to use the birthing ball, or me helping you rock your hips, or what we call shaking the apples, kind of giving you, maybe lifting up that baby for you. We're going to do all of those things, but it's all going to be led by you and your partner, and we're going to give you the power. And I think that's where you have that satisfaction of your birthing experience.
Awesome. And then another benefit of having a doula is women who are in labor, when they have a doula, they move more. So one big thing, even before I started doing doula work, I like I said, I treat a lot of women when it comes to pregnancy and postpartum. So I was even already doing birth prep with women. And my goal was, we need you to move. Even during the labor process, I need for you to move. These are different positions that will help open up the pelvis. That way the baby can descend. And now these are positions that will help to open up the bottom of the pelvis. So now the baby can come out. So a doula will be able to kind of guide you and walk you through that. A doula will be able to help assist you with different movements as well as you need. And also, most importantly with this, me personally, I was not someone who wanted to be tethered to the bed. So I wanted to be able to move and walk around. A doula can educate you as to when you need to be more so monitored closely, or when you can tell the doctors, you know, I'd rather not be monitored this closely. Can you kind of check back and see within a few minutes if both baby and I are okay? That way you can walk, because sometimes you need to walk in order for labor to continue to progress. Because if you're not able to do that, then you may just have a stale labor at that point. Things may just stall. And that's something we don't want. And walking can be relaxing. Also with this, with the doula itself, they can be there afterwards to help assist you with the initiation of breastfeeding. Now, a doula is not a lactation consultant. So there are times where they will need to make sure a lactation consultant comes in, especially if there are issues. However, then the hospital staff and the doula, they should be able to at least initiate the process with you. So that way, if you want to breastfeed, the baby can begin breastfeeding pretty much immediately after birth. I would love to hear if you have anything else to add to that.
I mean, you said it all. Most doulas have some general knowledge of lactation, how to get you latched on. But if you're needing more, you do need to see a consultant. If you give birth at the hospital, they have them on staff. You need to request to talk to them. Recently, I had a pseudo client she gave birth on a Friday, and they were like, "Oh, well, you can come back on Monday." But they discharged her, and she didn't push back. And she said, "Okay." She has also decided now that breastfeeding is not for her. And my thought process is, maybe if she would have been able to talk and got proper latching and proper how to hold her baby, that it would have been something she could have continued. And so you use all your resources. And that's what a doula is going to tell you. Well, we need to see why. Well, ask, when will the lactation be there? Is there somebody on call? Can I come back the first available spot? I want to be the best at what I'm doing. And with that, you need the education.
Perfect. Awesome. Awesome. All right. So how do you find a doula? There are different ways you can find a doula. There are different directories out there. For this one here, I just put 3. So DONA is probably the most well-known one because it is an international-based directory. There also is the National Black Doula Association. And then there is the Childbirth Association. Now, there are some different directories that are state-based. There are others that are national-based. These are just a few. Your medical providers, believe it or not, there are actually a good number of medical providers who will say, no, I've worked with this doula, or I like this doula, and I think you would like them as well. So that way the medical provider can potentially give you a recommendation. And like anything nowadays, you can pretty much find anything on social media. However, I will tell you, regardless of the route in which you find a doula, you want to make sure that you actually take time to interview the doula. And as you're interviewing the doula is also interviewing you, because the doula should not just accept your case just because, but you want it to be a good fit. And Ty, I will let you talk a little bit more about making sure things are a good fit.
Definitely a good fit. The social media, there's a group for everything on Facebook. I'm a part of doulas, midwives, and childbirth workers of my immediate area, South Carolina at large. And you would not believe the amount of people who are like, I need somebody for this. You need to know it's a good fit because you know what your schedule can handle. You can't have 10 mamas birth in the same month, because you can't be everywhere at the same time. And so you'll see a lot of on those groups I'm in, mamas will say, I have 1 opening for the month of March. I have 0 openings for the month of July. And so you have to know what your caseload can handle. One, because a lot of doulas are mamas, they have other responsibilities. And so you want to make sure that you're able to adequately do all the things that you're doing and do them well. And so that is the benefit of making sure you interview, making sure they know what they want. Do you want someone that's just going to be able to show up the day of? Do you want someone that's going to be there who can offer you around the clock conversations and support? When I say I have a pseudo client, that's because I realized that what she needed and what I could offer could not go together. New mama had lots of questions and needed somebody who wanted somebody from conception almost through a whole pregnancy. And my services start around 6 or 7 months where we're getting closer to delivery. And so knowing what you can do when you're having those candid conversations. And it's not a failure if someone says, you're not my doula. And it's not a failure if you have to say, I'm not your doula. It's about making sure you can service someone well.
Yes, and it's important that you find someone that will help you through the process the way you're wanting to go through. So the reason why I bring that up is because there are certain times when you have cultural differences and you want to make sure that a doula can be sensitive to that. There are some doulas that may be more well-versed in different aspects compared to others, but regardless, the doula's purpose is to serve you. They work for you. They don't work for anyone else except for you and your partner. So that is something just to be mindful of. So yes, it should be an interview process. Just make sure you get back to them in a timely manner. That is all we ask, because as Ty did mention, the space is limited. I know for right now, I don't have any openings for myself at all until the end of summer, and then maybe 1 or 2 in the fall. So, and that's because of, like we said before, we have different things that we also want to tend to. We want to make sure that people get the care that they need, and I want to make sure that we're available as well. So just like you're interviewing, please get back to them in a timely manner as well. Awesome. Well, that is all that we have for you tonight. And I know that I know at another time of evening. So if you do not want to turn your camera on, please do not feel like you have to turn your camera on. But we just wanted to say thank you for joining us. And we would love to hear if you have any questions, any concerns. Either you can stay on now and answer some of those questions. If you don't feel like talking, you can type them into the chat, or you can even reach us here with our contact information. I'm going to be honest, with me, just depending on the day, it is probably better to email and or do social media with me, simply because if it is a number that is not going for patient care itself, there is a chance that I may not be able to get back to you that day, but I definitely can get back to you within the next day. So you have our contact. We would love to know if you have questions, if you have concerns. And Ty, is there anything that you wanted to say before we open the floor up to anyone who may be on with questions?
No, I'm here for the questions.
Okay. Perfect. Well, let's see does anyone have any questions or any concerns at all for us? Awesome. Okay. Well, we would love to hear your feedback. So if you can, please let us know what you all think. So that way, so feel free to message us. Also, feel free to message if you have any questions. And if by chance you are someone who is considering becoming pregnant soon, you need help finding a doula, let us know. Reach out. That way we can make sure we put you in contact with different organizations, or at least point you in the right direction. But thank y'all so much for joining us. We really appreciate your time. We really appreciate you tuning in. And this recording will be sent out to you all and also to those who registered as well. So once again, thank you all so much, and y'all have a wonderful evening.
Thank you for joining us.